Hi, I'm Dr. Chaitanya Rao, your sinus doctor. If your sinus specialist or your ENT surgeon has advised a nose and sinus surgery for you, let me tell you 10 reasons why you should not delay your sinus surgery. Number 1, the sinusitis worsens with time. In sinusitis, there is pus formation within the sinuses. The pus comes out of the sinus and flows in the drainage pathways. These drainage pathways, on getting exposed to pus, start getting inflamed and swollen. This causes narrowing and further blockage of the drainage pathways. This leads to more pus formation in the affected sinus. After some time, the unaffected sinuses also start getting clogged up. The mucus cannot drain out of those sinuses also because the drainage pathways are becoming very narrow. This leads to mucus turning into pus. So there is pus formation even within the unaffected sinuses. So the sinusitis worsens with time as we delay our sinus surgery. Number 2, the results of the sinus surgery worsen as we delay the surgery. See, in sinusitis, we already discussed there is pus formation within the sinuses. And wherever there is pus, there is inflammation. And this causes some structural changes within the mucosa, the skin lining the nose and the sinus. Not only that, the bony partitions which separate the sinuses also get thickened. This produces a challenge during sinus surgery. And the more the bones are thickened, the more the mucosa has undergone change, the more difficult it is to preserve this functional unit, the mucosa, during surgery. So as we delay the sinus surgery results worsen. Number 3, ear problems. See, the mucus and the pus formed within the nose and the sinuses drain from the front of the nose to the back of the nose into throat. There are tubes called eustachian tubes behind the nose which carry the air from the back of the nose into the ears. This is the only way the middle ear gets the ventilation. When the pus flows over these tubes swell up. This causes reduced ventilation of the middle ear, and not only that, the bacteria in the pus flowing over the tubes travel to the middle ear through the tube. This causes repeated ear infections. What happens initially is the eardrum starts thinning down. There is formation of calcium patches over the eardrum and in the ossicles, that is the ear bones which conduct the hearing. This can eventually lead to hole in the eardrum, reduced hearing, ear pain, recurrent ear infections, and sometimes even a more dreaded complication, cholesteatoma. My colleague Dr. Sri Kadapa Rao has spoken extensively about the ear problems. You can click on the box above to see her videos. So as we delay the sinus surgery, the ear problems will begin and worsen. Number 4, throat issues. See, the pus which is draining from the back of the nose into throat inflames the throat, irritates the throat, and this causes a recurrent sore throat, recurrent throat infections, and the patients keep repeatedly clearing the throat. Not only that, it can also cause hoarseness of voice, that is change in the voice. The pus can even flow over the vocal cords. This leads to swelling of the vocal cords or vocal folds. Initially, it may present as temporary change in the voice, but as time progresses, vocal nodules, polyps, cysts can form over the vocal cords, and this can lead to a permanent change in the voice, which again needs a surgery. So as we delay the sinus surgery, we can have recurrent sore throat and also voice changes which can be temporary or permanent. Number 5, asthma. See, nose is like a filter. Just like when we use the bore water or municipal water which we get in our home, we always place this water in RO water purifier before drinking it. Similarly, when we breathe the air, the nose acts as a filter. It filters the dust particles, the pollutants, and not only that, it conditions the air. If we breathe in cold air, it warms it. Along with this, it also adds moisture to the air we breathe. By performing these 3 functions, it protects the lungs. When we are unable to breathe through the nose because of the nose block in sinusitis, we have to breathe through the mouth. These 3 functions cannot be performed by the mouth, because of which there is a lot of stress on the lungs. The research says there is a high chance for development of asthma in patients having sinusitis. Not only that, in patients who already have allergic bronchitis or asthma, there is an increase in the frequency of the asthmatic spells and also the intensity and the duration of the asthmatic spell. That is why when the pulmonologists see that their medicines are unable to help the patient up to the mark, they always get the CT scan of the nose and sinus done. Many of the pulmonologists regularly refer their patients to me for the sinus surgery. So, if we delay our sinus surgery, there is a high chance that you may develop asthma, and not only that, if you already have asthma, your frequency and duration and severity of the asthmatic spells will be worse. Number 6. Snoring and obstructive sleep apnea. Because of the nose block in the sinusitis patients, the patients are forced to breathe through the mouth, and the simple concept of opening the mouth itself causes snoring. With continuous snoring, there is a loss of elasticity of the muscles and the soft tissue in the back of the throat. Because of this, the snoring worsens with time. The snoring is difficult to people around us, but sometimes the snoring is associated with what is called obstructive sleep apnea. That is, the oxygen levels in your body starts dropping while you snore. This is not healthy for you. So with the delay in sinus surgery, you will develop snoring, which will only worsen with time, and you may even develop obstructive sleep apnea. Number 7. You may develop orbital, that is eye complications. These complications are not very common but can happen. See, the nose and the eye are separated by a very thin bone, what we call lamina papyracea. So the nose and sinus infections can travel through this bone into the eye. When this happens, patient can develop eyelid swelling, eye protrusion, that is the eye starts popping out or down, and sometimes the patient can experience severe pain in the eye, and when untreated can even lead to loss of vision. This is especially worse in patients having immunocompromised state. Number 8. Brain complications. See, the nose is also very close to the brain and is separated by a very thin bone called the cribriform plate. Again, these brain complications are relatively uncommon but can happen. The nose and sinus infections travel through this thin bone to the brain. This can cause meningitis, different kinds of abscesses in the brain. This leads to severe headache, paralysis of certain parts of the body, and if the treatment is not given in the right time, it can also cause death. Number 9. Antibiotic usage. As we delay the sinus surgery, the number of cold episodes the patient has increases, and the severity of each episode is also more. This pushes the patient to take antibiotics. But see, you cannot use antibiotics on a regular basis. There are two issues with regular usage of antibiotics. One, it affects your health. Two, you may develop antibiotic resistance. Once you develop antibiotic resistance, what happens is the basic antibiotics do not work for you anymore and you have to shift to higher antibiotics. Number 10. Lifestyle problems. See, if you are suffering with nose block on a daily basis which affects your sleep, you have to keep turning your body to the right or left because your nose gets alternatively blocked. You are having headache throughout the day, which is more like a heaviness in the head. You're having postnasal discharge, which causes you to repeatedly clear your throat, which can be quite embarrassing when there are people around you. This can severely affect your lifestyle. Research suggests that the sinusitis patients are more prone to having depression. This can affect your family life, your work life, your study life. So, delaying your sinus surgery is not beneficial to you. So I hope you have understood the 10 main reasons why you should not delay your sinus surgery. If you have any doubts about this particular topic, you can message me in the comment section below and I make it a point to reply to all your comments. Thank you so much and Namaste.